NASA's Artemis II is the first crewed lunar mission in over 50 years. 4 astronauts will venture around the moon, preparing humanity for a long-term lunar presence for scientific discovery and exploration.
NASA pushing its planned February Artemis launch to March due to technical issues. When Artemis does take off, it will make history in human space travel. And Purdue University living up to its reputation as a key player in space exploration with a heavy amount of alumni involvement in NASA's return to the moon efforts. The Artemis II crew will be traveling farther in space than any humans have before. A Purdue expert explains why that's also a new frontier in astronaut health.
There we can see visual confirmation of deployment of the 4 mains.
4 healthy mains.
Although astronauts may seem like superheroes, a NASA crew having to return to Earth early from the International Space Station just weeks ago due to an astronaut's medical issue,
and we see the 4th crew member of Crew 11 being helped from the vehicle now,
is a reminder that they are, after all, only human. And the 4 astronauts for the soon-to-launch Artemis II mission will travel farther in space than any humans in history.
Anything can happen at any time. The farther we go, the harder it is to come back quickly. When you go farther away, everything gets more complicated.
Astronauts haven't traveled beyond low Earth orbit since the Apollo moon landing, so for the first time in over 50 years, Artemis II is going into a different radiation environment.
That certainly has some consequences on crew health that we don't know everything about.
We have a moonican. We will also have 2 torsos that are learning about the moon and learning about the environment.
The uncrewed Artemis I mission used mannequins to study the biological toll of deep space radiation. For Artemis II, scientists believe the total radiation dose for the 10-day mission will be similar to that of one whole-body CT scan.
Everything looks like it's going to be good, but you're not going to know until you go.
Artemis II will also break ground in mental health as it blasts deeper into the cosmos than ever before.
That has some pretty interesting consequences for what's your psychological state of mind when you're on board that vehicle and you're thinking about you're now one of 4 people who is farther from the rest of humanity than anyone else in all of human history.
The astronauts will wear a device on their wrists to help study their well-being, activity, and sleep patterns. The prolonged isolation and confinement of space travel can increase the risk for anxiety and depression.
If you look around what people are working on in terms of spaceflight, this is part of it. How do you assess mental health of crew? How do you maybe help them in times when, they're very far away?
Also challenging the crew's mental toughness, it will be the first time in more than 50 years the astronauts will experience a communication blackout with mission control for about 45 minutes as the spacecraft passes behind the moon.
That's a really deep philosophical thing to kind of consider, especially whenever they go into periods of blackout where we won't be able to communicate directly. You're very disconnected and very far away.
From psychology to safety, NASA says astronaut health is its top priority.
The need to discover, the need to explore, that's rooted in who we are. Whatever we have to do to ensure that we continue exploring space in a healthy way, all the better.
DeMars says there is research underway looking at new methods to help astronauts' mental health in space, including counseling, using virtual reality for relaxation, and communication with their families. Hancock Health is using its podcast platform to make conversations about health topics more accessible. Just Jen features interviews with Hancock Health doctors and experts about topics that impact women. IBJ's Daniel Bradley has more on how healthcare systems are using podcasts to reach patients in this weekend's paper.